It was announced on Thursday that there has been a rise in the number of coronavirus infections in 3 North East council areas, according to the latest figures by Public Health England. Between the 22nd of June and the 28th of June, the infection rates in Redcar and Cleveland, Hartlepool and South Tyneside have seen an increase in infection rates. The North East chairman of the British Medical Association, Dr. George Rae, has discussed how the pandemic has affected the North East.
I think that unfortunately the death rates in the northeast of England from the coronavirus, if one looks at the death rates as far as 100,000 of the population is concerned, unfortunately they have been high death rates in comparison to other areas, for example, in the more affluent areas in the south of England. So that is something that we are concerned about. It's now a fact. And it's something we will have to be doing something about in the future. But we're entering tomorrow, Saturday, the pubs are open, people will be going to the pubs, and when the weather gets better, of course, people will understandably want to go to the beach. And when people flock to the beach, then you've got to be aware of the fact that this virus is still about. And if we are complacent, if we lose all the gains that we've had, which have been brought about by people following the guidelines, staying indoors and so forth, if we don't follow the rules and the advice which is being given, then we can have little potential spikes of the virus, little clusters of the virus. The cluster could then lead to regional epidemics of the virus and so forth. So we've got to be very careful. We've got to keep what we've gained up till now. And of course, tomorrow being the opening of the pubs, that is something which very much has got to be borne in mind.